Hello, this is Integral Dose Podcast. My name is Sarah.
My name is Atika.
And my name is Sarah.
Another day,
another
dose.
This is the podcast that covers all things related to, integral to, radiation therapy. So clinical attachments are very important for students. It's a period where we are able to bridge the gap between theory, what we learn in school, and reality. So through these attachments, we are actually exposed to real life clinical situations where we learn and pick up skill sets to handle these situations and learn how to adapt to different patients, to achieve the clinical and treatment outcomes.
How do students get into clinical attachment in the first place? And who decides or actually plans their attachment? Today we have our senior, Kevin Lim, a principal radiation therapist who is also our clinical liaison for our students. Is that what we call it, Kevin? Would you like to introduce yourself?
Hi guys, I'm Kevin. Actually, the official term is a clinical education coordinator.
Okay, so how long have you worked in NCC and how long have you been in this role as a clinical education coordinator?
Oh, this is my 20th year in NCCS. I have been taking on this additional role of a clinical education coordinator or CEC for the past 1.5 years.
How is it so far? Now 1.5 years.
So far, it's been very enriching to me. Yeah.
Okay, so enriching as in...
What are the roles that you that entails with your
Well,
responsibility, like your title?
okay. The CEC is a registered healthcare professional of the respective profession from the clinical practice education or CPE provider. In this case, it's NCCS, who licenses with the SIT faculty to facilitate clinical education for SIT students. The CEC will have oversight of all the CE's schedule and the provision of appropriate and adequate resources and support for students learning at the clinical setting. Well, other than the local SIT students, our center also hosts foreign RT students from Malaysia, Australia, and the UK occasionally. In my role, I act as a neutral and independent middleman between the clinical institutions and the Division of Radiation Oncology.
Oh,
Wow, that sounds
interesting.
like a really big role.
Yeah, and
Host foreign RT students from mainly Malaysia, Australia and UK lah, right? So far, we only have Australia students come to
I think
intern.
we've encountered Australian. I also have met students from UK.
I think majority is like Australian, right? Somehow.
Yep,
A lot
so
of them are
far,
attached here.
yes. Later on this year, we'll have a Malaysian RT, coming about 3 weeks. And the UK also later this year from the University of Liverpool, which we are still liaising with them.
Wow, that's so interesting.
Going to be finalized soon.
Is it a form of like collaboration between their university and us, or is it just like a...
For the Australian side, we have a memorandum of understanding with University of Monash. Yeah. So for the Malaysian side and the UK, it's not really formal. They write in to request.
Oh. So is it during their summer break or something like that? It's on their own time, or is it in a school curriculum?
I think it's part of the
Credits.
to accumulate certain number of clinical placements. So it's up to them whether they do it locally or overseas in our center. Yeah.
Oh, so cool.
I mean, they are given a choice, so they will prefer to do it in our center, a big center, which is new and with all the facilities that we have. Yeah.
That's true. That's quite nice.
Yeah.
Right? I mean,
Do they contact you directly, or is the university that contacts you directly?
They do write in personally.
The students themselves?
Yep, they
Wow.
write it to our Department of Cancer Education, which gets forwarded to us. My colleague Joe usually handles the administrative stuff. Then once it get approved, it will flow down to me. Then I would handle the clinical stuff.
That's where you coordinate like which units they will be
Yep,
at.
depending on their
and-
needs, and objectives.
Right.
That's interesting.
actually, we have quite a few colleagues that did a degree overseas as well, right?
Yeah.
we do.
So when these students come here, then they also share their experience from their center.
Yeah.
And it's quite nice to learn about the different practices.
And recently we had the student from Monash University I think in the Allied Health and Pharmacy Day episode,
Yes,
she
actually,
came by.
Yeah, correct.
Yeah.
Spoke about her experiences and how she's doing lah. Yeah, it's quite nice.
I think locally just now Kevin mentioned about liaising with the SIT faculty. So SIT, just for the listeners who may not be familiar, is the Singapore Institute of Technology. It is our only university in Singapore that offers radiation therapy formal
Yes.
education
Yes.
towards a bachelor's. Yeah.
And I was from there, so I'm the second batch.
You're the
So
second batch.
Yeah, I am, yeah.
Right.
So it's quite cool.
Somewhat the pioneer lah.
Somewhat lah.
Somewhat lah.
During your time, Kevin was the one doing the liaising, I suppose, because he just started 1.5 and you've already worked here for like 4 years.
Not yet, I suppose. I think it was mainly our director now, Yusnita,
Yeah.
and also Joe lah. Yeah.
So Kevin, there must be a lot of work going on. So what are some of the challenges you face as a CEC?
Well, definitely there are challenges. There are a couple. So one of the main challenges I face, number one, is to find a suitable clinical educator and a student to pair them together for their placement. Well, this involves checking what type of cases that the particular student needs to be competent in, and whether that room is available during that period or is it under like maintenance. Next, I will check the CE leave schedule to see if he or she is available to supervise during their placement period. Usually we rotate the CEs around, each taking turns to prevent burnout and to ensure fairness. I also must personally make sure that the CEs are around for the majority of the placement so that the students can be assessed accurately and objectively. Additionally, I will also be on the lookout for interesting and rare cases like TBE or total body electrons, TBI, total body irradiation, and arrange for the students to observe these procedures.
Oh, there's a lot of things to consider.
There's more.
It's not just
That's all. Oh,
then
this
what-
is just the surface. Okay, there's
it's
more.
just the start.
But then what if like that CE is suddenly on leave? Like, is there like a backup CE or?
Usually the next in line, the next senior in line, if it's like an ad hoc MC, we can't, prevent all this. So it's just 1 or 2 days. I don't think it's much of a problem.
Yeah, that's
But
true.
if it's like a HL kind of hospitalization leave kind of situation,
Then
You would
I think
have to
we will have to
relook.
reassign. Yeah, if it's prolonged MC, HL, things like that. Yeah, to be fair to the student.
That's true.
That's
Yeah.
true.
There's also other challenges. So one of my immediate priorities is to improve on the student satisfaction scores. So how do I plan to achieve this? Is to engage the students more frequently, where I do my so-called rounds when my clinical duties are completed, or at least once a week. So during these rounds, I speak to the students individually and also seek their feedback on issues on learning that they think can be improved. I also check with them on their well-being, any difficulties they might be facing in their learning needs, and try my best to help them. These can include arranging for extra tutorials or practical sessions to reduce their learning curve and to clear their doubts. During the recent placement last year, one student mentioned a lack of workstations for them to do their work on. So what we do is we open several workstations at basement 4 to cater to these students for their own use before or after their clinical hours. Other than engaging students, I also encourage the CEs to give continuous and timely feedback to students so that any mistakes that can be spotted can be corrected early and not let it persist on.
wow.
Wow, it's actually a really like
You're not just an educator,
Yeah.
but or someone who liaises, but
With
you
a lot
look
of people.
yeah, it involves a lot of people and a lot of constant following up. It's not just a sign and go.
and he's always working on something to improve on, and he also looks out for their well-being. Actually, that's a lot of
Which is super important.
Yeah.
Cannot stress that enough.
yeah.
Yeah, I mean we were all one students. It can be quite daunting.
The third challenge is the widening age gap between the students and our CEs. To counter this, I'm recruiting more younger CEs to join our clinical education team. I believe the students will find it easier to relate their issues to someone closer in age as themselves, compared to someone much senior in rank. Also, these CEs are graduates of SIT too, so they already know the drill and the paperwork that the students need to complete. it is like killing two birds with one stone.
Oh, you are right. I did not think of that, but that's
Yeah.
true. I
I
mean,
mean-
coming from the same home,
Mm,
I guess Cs who were also SIT graduates would really know the expectations. I
correct.
suppose they are able to guide them maybe a little bit better.
And I think because like what Kevin mentioned, for us who went through the Nanyang Polytechnic route, the expectations, the paperwork that we need to do, and our competencies that we need to complete are slightly different in nature. It's just slightly, might be a lot actually.
The type of cases too
Yeah,
is more
the-
advanced technologies
Yeah.
now, IGRT, Proton.
Yeah.
So it might be outdated, our
That's
curriculum. Yeah.
true. Wow,
There's
I
no
didn't-
more conventional sim.
I'm not
Yeah.
sure about the
Right.
comparison, but I think probably.
Never really thought about that, but
Actually, never really thought about that, yeah. Actually, now because the first batch of SIT students are here at NCC, which are our colleagues also. They're about 5 years. 5 years, right?
Yep.
What is the minimum number of years required before you can like be a CE? Any idea?
3 years of working experience, and also you have to have a AHPC full reg. Yep, in order for us to send your name for the ICE workshop, which is conducted twice a year by SIT. I stand for I am a clinical educator.
Catchy.
It's to break the ice. Yeah.
So it's like official lah.
Is there an expiry date for the ICE? For like
So after attending the workshop and meeting the requirements, you'll be given an official letter of appointment by SIT, and title of a clinical educator lasts for 3 years. So so after 3 years we will review. So whether you'll be renewed, maybe you have other interests and not in clinical education, then we can take your name out and we can put more younger people inside. Yeah.
Oh wow, actually I quite like that renewal system because it makes sure that the CE is capable and like up to date,
And also that the CE
Has been
not
doing
just like
his or
capable
her
or up to date, but like sometimes the CE may not be available, like they have other
Yeah,
responsibilities already.
commitments,
Yeah,
you know.
that's true.
Mm.
Any idea about the ICE training? Is it a very vigorous training?
It's a 2-day course. Usually, since COVID is been held online.
Oh really?
Yeah,
Wow.
so
okay.
it's a Zoom, done via Zoom. Then, of course, there's theory and both practical being taught. So, like, they'll teach you the curriculum, the requirements, and how to maybe manage students. They'll put you in scenarios, role playing, things like that. Yeah.
Have you?
I went
gone
through. I went through
Yeah.
before, but that was.
Sarah is a CE. Actually, all of you guys except me.
Yeah.
But my CE expired.
Yeah, I think because of where we are located, so we haven't really taken any students in our room
That's true.
in our treatment unit right now. But from what I remember, right, the CE course, I think you have to go through role playing, and then when you do, you also have to take like a competency test where there is a mock student.
Alright.
Like they hire someone to act as a student, and you have to talk to the student about, maybe they will give you a scenario like, maybe okay, this student is supposed to act out like this is this. You wouldn't know what your student is like, so you are supposed to respond to it. I was scared.
I remember. It could give you quite a nasty scenario, right?
Yeah, I mean it's more of like,
nice and nasty scenarios,
Yeah.
because you never know what you will
Kind
encounter.
of student you will get.
I'm not saying that we have nasty students, but I think like what we have said before, usually it's because of the different situations, the different circumstances. They may have a difficult time.
Right.
Yeah, so
Yeah.
it's really getting to know them and see what
What they need.
challenges they are facing and how we can help to resolve that. Yeah.
You're right.
I remember I took the ICE workshop during COVID. And then they break into rooms inside the Zoom. Zoom online. And literally the person is just with the camera on, and that person is supposed to act as a student
Oh.
something like that. Then you are inside that room with that student.
And examiner.
Examiner, yes.
Oh.
And then they were just like, what would you do in this situation?
Yeah.
Kind of thing. So it's just you and the acting student plus the examiner will be in that breakout room, try to see.
And there's a time limit also, right, to that whole
Yeah, there's a
scenario.
time.
Cannot take too long to think.
Yeah, I mean in real life also we don't have all the time to talk to the student. Sometimes you only have like maybe 5 minutes in between your cases, and that's the only time you can try and talk to the student. So I guess that's where the time management comes in. How would you manage during that short period of time?
So as a CEC, what are your hopes for the students who come here? Like, what do you hope that they take back the most?
Well, I know that being a student nowadays is really not easy. They have so many expectations to fulfill coming from all different directions. So at the end of the day, I do hope they can develop a wide spectrum of skills and attributes. For example, like time management, communication skills, prioritization, decision making, problem solving, empathy, resilience, teamwork, reflection, and perspective. That sounds like a lot.
It's a lot.
I think if a student hears this, they'll be like, wow.
I'm so stressed.
But I think it's really true lah, cause when you're here, you're not just here to learn the physical skills, like the skill sets needed, but really it's a combination of everything.
And these are also actually life skills actually. It's not things that you only have to learn at work, but outside of work, these are skills that you will need to apply in your life. Like I like this keyword prioritization, because when you start work and when you have to deal with many different types of cases, some patients may be very sick, and you may have like 2 or 3 patients who are very sick at the same time. Who are you going to prioritize in that sense? Or like how would you try to manage all the patients' expectations when there's only one of you at that point of time?
Right. You only have 2 hands. You only got 1 room. Which one do you prioritize first? So you got to learn all this in our real life clinical setting. It's not all about theory or your practical skills only. It's about decision making, problem solving, and most importantly, working in a team.
I think we say this a lot of time.
Teamwork makes the dream work.
And somewhat in our radiation therapy setting, I feel like unlike other like health professions, I feel like our profession is quite focused. Is it focused?
Quite teamwork based.
Yeah, it's quite teamwork based in a lot of the rooms. There are also roles where you will have to work individually, like our dosimetries, but most of the areas that we work in are based on teamwork. So I think teamwork is a very big thing.
It is a very big thing.
Not only on a unit level, where we work in a team of 3 to 4 therapists, we also work with the doctors, the planners, the nurses, the front counter staff even, and research coordinators.
So it's not just communicating with radiation therapists, but you need to learn how to communicate with other healthcare professions, because like what Kevin said, we're not working just with the radiation therapists, but the nurses are also taking care of our patients. Our front counter staff also manages our patients and all that. So like we need to be able to communicate as a team, communicate effectively also.
Yes, effectively is
and
the key word
timely.
here as well. Sometimes time is of the essence. You need to know what to say, what to include in the most concise, efficient way. Right? And the message is passed on so many levels, so you need to make sure that it's passed on properly as well.
Correct.
That's why everyone has to play their part.
Yep.
But Kevin, speaking of all these skills and like attributes, right? So far in your experience, what do you see students struggling the most with? Is it hands-on skills or communication skills, or sometimes they're just stressed in trying to fit in? All these things are very relevant and very real. Can you elaborate on that just from your...
Well, I guess it depends on which year of studies they are in. So usually the clinical placement starts in their 2nd year. So they are really new and green to this clinical placement. And they might have the theory, but I think they are very new in their practical skills. So the 2nd year students might be very green to setting up patients, and they might be very shy in talking to patients. and maybe they are lacking in patient care, so we can pay more attention on their practical skills and their patient communication and soft skills with the patient for the second year students. So moving to the third and fourth year students, they are a little bit better in their practical skills and patient communication. But they are also usually sent to rooms that are more complex, like simulation or planning, which have a steeper learning curve. Yeah. So their theories on RT physics, RT theory will be more in focus. It's different skill sets for different years of clinical placement, I guess.
I couldn't agree more though. Yeah.
I was actually reflecting back on like my first clinical attachment.
Yeah.
And really like my clinical supervisor played a big role in getting me adjusted to the clinical setting because
Grounding, right?
Yeah, it's our
Yeah.
first time stepping into radiation oncology
It should be nerve-wracking.
department.
Yeah.
You don't know your way.
Yeah.
You don't know exactly what all the machines are doing. And you need someone to go through all the processes. And even like for me, I was quite scared to talk to patients initially. So your clinical supervisor will be the first to like help break that ice between you and talking to a patient. They taught me like, okay, this is what you should ask. What's the first thing? Usually, I think when we come in as a student, the first thing is like, okay, check name, IC number.
Yes.
Ask how are you?
Yeah.
Pain score. So this is like the most basic. Then from then on you start to build your conversational,
style, right?
your own style talking to the patient.
The application part is a bit hard when it comes to student because it's their first time. They haven't done it for the year 2s lah. But yeah, like Kevin say, year 3s and the 4s are more in the complex rooms. So they probably have to apply their theory as well as doing it in front of their clinical supervisor.
Yeah, correct. And I believe that prior to us being in Proton, we've seen many students of different, coming from different studying years. And then we really do see them like blossom and grow into the artists that they are. They are here today lah, because some of them are juniors now. But you really do like, maybe when they come in year 2, they're quite shy, very quiet. Then like 3 and then 4, you see, wow, like they're pretty good. Their skills are good, they can talk to patients. They're actually quite outgoing. Because when you're shy in year 2, maybe you may think that the student is a bit of an introvert, right? But I think it's just a bunch of nerves at the start.
And some students might need more time than others to sort of
come out of the shell.
Yeah.
So you just have to be very patient.
Slow and steady, yeah.
Yeah.
You will eventually get there, yeah.
Golden words.
I would say like even from what I remember, right, my own experience, I don't really talk much with patients all the way up until like my 3rd year in Nanyang Poly, which is like our final year. So I only truly got the hang of this communication skills with the patients specifically only when I started working. Because like sometimes when you move around different centers, there's different culture, different expectations, and the way they do things are a bit different. So it took some time for me to get used to their processes before I could even overcome that challenge of trying to talk to a patient. Yeah.
Look at you now. You're totally overcome already. You're hosting this podcast.
Africa is really good at talking to patients. I mean, you can tell.
And joking around also with patients. Okay.
Yeah.
But yeah, so to the students out there, I think don't have to worry so much lah. You will build your skills in time.
And you'll build your confidence over time.
Yeah. So Kevin, being a CEC for 1.5 years, what do you like about this role?
Previously, I already been involved in educating and supervising NYP RT students and also our interns for over 10 years already. So during the COVID pandemic, our previous CEC Madam Yu, Snita, first asked me to consider taking up this appointment in addition to my clinical duties. So when she took over the role of head RT services, I stepped up to assist her in this area of clinical education. After 1.5 years into this role, I've enjoyed the process so far because it allows me to pick up some administrative duties on top of my usual clinical work. So this provides a good mix. It also involves a lot of talking with both staff and students, and also a lot of coordination work between the educational institutions, NCCS, and also other agencies like MOH Holdings.
Interesting. How did Yus approach you for this role? Is it because she saw that you are interested in it, or you step up, or like how?
Yeah, did you indicate
Like voluntarily?
interest?
No.
No.
Okay.
Or how would someone also as interested like want to in the future, you know,
Want to help
maybe
you,
help
maybe.
you with it? Or
She just asked me in the pantry.
Ah.
She just asked me because I think I was doing like supervising the students and interns. So she liked to read my reports. She thinks I'm doing a lot to assess them, to help them. So she asked me to take over the position of CEC because she thinks I'll be able to give a fair assessment, you know, detailed. So
That's good,
she asked me to
what?
consider.
Yeah.
nominate
good, what?
her.
At least she
That is
recognise your work.
great.
Yeah.
So I didn't give her an answer because I wasn't sure. Because she has been the CEC for the longest, and I don't think I could like step inside. You know, it's a big shoe, two big shoes for me to. Yeah. So I give it a thought through many years.
But that's good
Until
lah.
she had to become the head. I mean, she got too much on her plate.
Yeah.
Yeah. So then I decided to help her in this small area.
Good
Yeah.
job.
That's good lah.
Yeah.
I mean, actually writing a report for a student. Have you done it before, Sarah?
No, I haven't done it
So you
before
haven't?
because my one is like during the COVID time, and then like there's no students, right? And then like when I already graduated as a CE, there's no student coming
You
in.
haven't had any
Yeah,
students?
so I haven't had any experience before. Then I was brought into Proton.
Yeah, because Proton just started. But last time I was a clinical educator for a short while when I was under Kevin. Kevin was my in charge at the time.
Kevin.
That is how senior Kevin is. Anyway, I have been like a clinical educator for I think definitely less than 5 students, and really writing the report is quite challenging.
Is it a long report they have to write?
It's not a long report, but I mean, you would want to give constructive feedback. You also cannot give too vague a feedback. And if you've never written this kind of like assessment report before,
It's a bit hard. Right?
it can be
Takes a
quite
lot to
hard.
phrase it like.
And I think right now both of you, I know Sarah is in our proton therapy room. We have this EPA, which is a competency-like system. What does it stand for again? EPA.
Entrustable professional activity.
Yes, thank you, Kevin.
Wow, that is why
Entrustable.
he's the CEC.
Yeah.
She knows.
I'm just giving an example that when we have staff coming into the proton therapy treatment unit, they have to go through training because it is considered a new modality in Singapore. And so like the current staff in proton who are already fully trained, they will then subsequently take on the role of supervising those colleagues who just joined the team. So what they will do is they will also have to review these competency reports that the staff in training would have to make. So Sarah, you have...
Yes, I have.
It was difficult, right?
It was difficult. I tried to come up with words like, so when you put it in words, it's like, okay, this person has progressively shown blah blah blah.
Yeah.
Then you cannot just write everything very good, at the first start.
Correct.
So you must always have something like, okay, she needs to improve on this thing.
Or like this
But
is where they did good in.
the next report or when they submitted, then you can say, okay, she has improved a lot from the first one. So it's like a progression lah. It's like cannot straight away just say, oh, very good,
Yeah.
very excellent this one time.
Very excellent.
Yeah.
It's a bit different when you're managing students and the staff.
Yes,
You got to
it's very
be
different, yeah.
more sensitive. This is your colleague who's going to be working with you.
That's right. Yeah.
Yeah, you can't be too relaxed or you can't be too mean also.
Yeah. That's
And
right.
sometimes like the report that you are doing for also could be someone who is actually more senior than you.
Yeah.
So
correct.
it's a slightly different. Is it different? I don't
You need to
know.
know how to phrase it very tactfully and
Yup.
very constructively.
balance.
Yeah.
Not say we are tactless with the students,
Yeah,
but
correct.
same but different.
Yeah, it's just that okay, maybe like because for staff you already know there's a certain level of expectation,
and
competency that
expectations.
because when they come in they have to fulfill certain criteria also, like how many years of working, so they are experienced, sort of. Whereas like for students, they don't have experience before that. So the way we assess them will definitely be different.
Yep.
Actually, do you have any tips on how to write a report for students?
Nowadays we have ChatGPT. So you can just key in. So I have to think everything from scratch.
Everything from scratch, right?
Yeah, I have to use different adjectives.
Yeah.
I have to search the dictionary.
Oh my god.
So I don't want to make it monotonous. I don't want to make it like a copy over a previous student's report. So I spend a lot of time thinking. Yeah.
That's why you're a
And
CC.
coming out with something truthful and meaningful,
Yeah.
and something of value that the students can read and think for themselves. Yeah.
But even now, if we use ChatGPT also, we cannot wholesale use what is given to us because I think it can be quite obvious it's from ChatGPT.
Yes.
So I guess ChatGPT will just give you the frame and then you will have to rephrase in your own style.
Correct, right? Crafts out like a body for you.
Yeah.
Yeah, which is nice.
There's different methods of how to give feedback to students. I'm not sure whether the same is being taught during the CC. Like there's this like sandwich method that I was saying. So
we were taught
Yeah.
during the ICE workshop, the sandwich method, not sandwich maneuver, sandwich method, yeah.
That one is
So
the
we will
CPR.
ask the students first, what do you think you are good at? Or what do you think, what can be improved? Yeah. So we will use that method first, then we will listen to what he or she has to say, then we will give our input.
So this method actually helps the students to reflect and at least also give them a chance to stand up for themselves. Like
Correct.
Yeah, if they have something to, like a
so we can understand the
some
way
other
they're thinking.
concerns.
So there are like these skills are being imparted to the clinical educators in the first place. I think it's quite it's a good skill.
Yeah, it's a good tool to assess them.
So I remember when I was a student, and then after every rotation you have like a form to fill on performance and things like that. So I remember my CEs, they will always get us to fill in ourselves, like rate yourself for different aspects of like your skill sets. And then they will look through and they will give their rating, so you can see whether it matches. Which I think is nice, because when you make the student fill it up themselves, they are thinking, they're reflecting. And then as a CE, when you give your rating, you're able to see that difference, if any, in how maybe the student sees him or herself in the skill sets, and they're able to perhaps advise and assess from there. Because I think there have been times where I give myself like, let's say like a slightly lower score for certain aspects, but toward the CE, maybe I did pretty well in that section. So I think that also boosts the morale for the students. But I mean, likewise, if it's the other way around, the student can reflect and learn and improve from there, which I think is a kind of constructive feedback on its own. Yeah, which is a nice component to include, I feel.
I didn't know you had to do that because
Our time don't have.
Yeah, from what I remember, we didn't. It was just solely feedback from
Correct.
the supervisor.
Verbal, like a report.
Verbal and written.
Yeah.
Written, but it's just like a open-ended thing. Or
Not
there were like
really-
things to tick
Not
off.
There were things to tick off, like this. You have performed this skill set, and then like briefing a patient is also a skill set. Our supervisor will also go through with us the whole assessment, like usually like the whole 4 weeks or 2 weeks that we're with them, how we performed.
But I guess now it has improved a lot from our time.
In the past, maybe it's just one way.
Yeah.
So now it's
from-
we try to
two
encourage
ways.
2 way.
Yeah.
We want to have a feel of what the student think also to tell us. Yeah.
Because sometimes as a student, if you feel that you are actually did quite well in this part, but your supervisor don't, then you want to know why.
Like, why is there the mismatch?
Yeah.
Correct,
Yeah.
yeah. And like vice versa also. Like sometimes I feel like, oh, I didn't really do this well, but actually to the supervisor, you're doing,
You're doing quite well.
yeah.
For your standard, maybe for your level, maybe it's really very good. Yeah.
Yeah, you might
So-
feel just average, but actually doing quite well. Actually, it's also building on what Kevin said. I think it's quite heartening to know, like as he mentioned, his thought process in crafting like a report for a student. Like he really ensures that he tries his best to make it like impactful, meaningful, and not just like, oh, I have to get this done,
Yeah.
Because all these things, when the student reads it back, it will affect their confidence.
Yeah.
I feel it's a very important role to play.
So Kevin, is there any message you want to put across to the students or the clinical supervisors who will be taking care of the students.
Oh yes. So for the student, I would advise them to enjoy the process of actually being a student and not to be too hard on themselves if the things do not go their way during their clinical placement. So they are only undergraduates once only in their lives, and being a student is actually very different from being part of the workforce. So they should actually study hard and play hard at the same time, maximize their youth.
Wow.
For the CEs, my advice is to welcome the students like guests and to be a gracious host. It is meaningful to be tasked in educating and training our future radiation therapists. So mentor them to the best of your abilities. Keep an open mind and set up a good example. You may just be the student supervisor, but they are watching and listening to every comment that you give them. Who knows? The student might turn out to be my own radiation therapist that will do my own treatment 20 to 30 years down the road.
Wow.
I mean, true.
Yeah.
You know,
Okay.
actually, we are all quite shocked by how meaningful that was.
I thought you were gonna say that the student may turn out to be your own radiation therapist teammate, but no, it went one step further. It might be the person who will be treating you in the future, which is
You never know,
absolutely
I mean, the future is uncertain.
real. Yeah.
Yeah.
The future is uncertain. So whoever you meet in your life, you just have to be good to them, right?
Yeah.
Right? I mean, like, as a CE especially, you have to be good to your student. It's a fine line, like, macam... Oh, macam...
Macam lah.
I'm supposed to say is just be good to everyone.
I mean, as students, all of us being students before, we can attest to it lah. Cause we really like absorb what we see, hear, and feel from our surroundings. We learn from it.
Yeah.
So there can be good and not so great experiences as students. So we will learn and we process, and through all those, we are able to grow into who we want to be.
Yeah.
Like maybe you find a senior who has really good, habits and skill sets in like communication, and then you tell yourself, oh, so this is how she communicates. I want to be like her when I am a full-fledged radiation therapist as well. So you pick up those soft skills.
Yeah.
And someone who is really like fast and good with her hands, very skillful, like molding the vetlock and things like that. You want to pick up those skill sets.
Yeah.
So we see, we observe, and we learn.
We
You
on
learn
it.
the good things from
Yeah.
each and every one, and you
Correct.
combine into something that
There's your own.
you're special. The only one that have these skills, yeah.
And I think like what you said about the first impressions as a student, we always think like from a CE perspective, the first impression we have of a student is the most impactful. But actually, it's also the other way around. Like how the student sees us the first time will leave a lasting
impression.
and that's how they are going. That's like
How they're gonna perceive it
correct. How are they gonna perceive you for?
things down the road.
So if the first impression is not good, but actually it's just like that one off to the student, it might be like, oh, okay.
So this is
Correct.
how it is,
Yeah.
Yeah.
That's why I always like, this clinical placement is like their second home for the next 1 month or 2 months. So we should be welcoming. So we should like treat them, like welcome to their home.
Yeah.
So we are your extended family for the next 8 weeks. So what impression you give to the student is very impactful. So do not appear cold. Treat them like guests. Be a
Treat them
gracious
like a
host.
teammate.
Impart the skills to them. Yeah.
During your time as a CEC, right, Kevin, do you have any students like praising their clinical supervisors?
Yeah, many, but
Shout-outs.
they won't, say it in front of them.
Ah.
So at the end of their placement, we give them a feedback form. They do write their names and what things they are impressed with. Yeah. So I will only read it, and also it gets sent to the higher level up. Yeah.
So
My
that
boss.
they can be acknowledged, like,
Yeah.
That's good.
and
That's good.
recognized.
Yeah.
Right.
Do you mind sharing some? I mean, you can anonymize.
Yeah.
But what are some of the
Nice things
Yeah,
that
nice
students
things
have
that the students
written.
say.
This is from the overseas Monash placement procedure. She's been with us for over 3 months lah, so it's pretty lengthy. So it's written a very nice thank you letter to us, to our department, for hosting her. She is thankful to all the staff that has taken their time to explain concepts to her. He has enjoyed the times here. even bringing her around the area to try out new food and to reconnect back to her original roots. She's a Singaporean, by the way. Yeah, and she's also deeply thankful for all the unwavering guidance that she has received in each and every room rotation, and how accommodating everybody has been to her learning. It has been a very deeply enriching and rewarding experience.
That's so nice to
That's
know.
nice.
And she will surely miss this team when she returns to Australia.
Aww. So
Do you know if
sweet.
she's coming back?
Hopefully,
Hopefully.
once she
Ah.
finishes her masters.
Maybe
yeah.
we'll see her.
Maybe we'll see her.
But even if we don't get to see her again, I guess I'm glad that our colleagues were able to make her
Experience here.
a good
Pleasant.
one. Yeah.
Feel comfortable lah and welcome.
Yep.
So if there's anyone interested in doing job shadowing, is there a proper channel to this?
So usually the Division of Cancer Education, DCE, is the main unit in NCC that is involved in the training and education of allied health professionals by providing a wide range of well-structured programs and events which are developed and taught by a team of qualified educators. So interested applicants in job shadowing can write to the DCE directly. Then our department will take it from there if you are deemed suitable. And also once a year, we also host JC Poly students in a program we call Huddle Plus. This is in collaboration with MOH Holdings, where potential future healthcare scholars can have a feel of what is it like being an AHP before they enroll for the university course.
Wow, I think that is nice and that sounds new because even back in my days, we didn't have that. Yeah, I think it's a very good program and outreach program per se to let the younger generation know more about
Yeah.
AHPs.
The Huddle Plus, when was it established?
I only has been in this role for the past 1.5 years.
Oh.
I've hosted 2 times.
2 times of
Yeah,
time.
so
you go to the JC.
no, they come here.
They come
they
to us. So you
Yeah.
plan the program for them.
Correct. So
So they can free
they
to
write
sign up,
into
right?
MOH, they sign up with MOHH, then it's not only in radiation therapy, across the whole spectrum of allied health. So diagnostic radiographers, dietitians, MSWs, physio and occupational therapy. So we do host them on a 1 to 2 day basis, where they go around the whole department. They tag along with a qualified radiation therapist, which they explain to them their workflow, our culture, so they see for themselves, how is it like being an AHP and whether is it the correct choice for them before they embark on their university career, and also citing potential healthcare scholarship with MOH to serve after they finish their studies. So it's to see whether it's a right fit for them.
That's very, very helpful actually.
Yes. Actually, even I don't know whether how long this Huddle Plus has been ongoing, but I do remember like even many years ago, we do have individual junior college students who will just write in previously to the departments, I think.
Yes.
Yeah. And then they will come in and have an attachment. Usually it's just like an observation one day, if I remember correctly. But now it's a bit more streamlined where they go through the cancer education unit. Am I right? Is
it a portal through MOH website?
This one I think they
Or is
go
it-
directly to MOHH, then which
okay.
HR will liaise, and also DCE will come into the picture. So after everything's
okay.
settled, it flows to us. So we will conduct the physical tour and the job shadowing.
Actually, speaking about writing in, before I got into this degree, I actually wrote in to look for like a job shadowing.
Oh.
But at that point, they were saying something about the radiation therapy job shadowing like portal is closed. So I'm not sure but it had something to do with the dosimeters. Like maybe there weren't enough going around. But I wrote into both diagnostic radiography and radiation therapy. So radiation therapy, they couldn't get me a shadowing, so I got one actually for the diagnostic radiography side. Yeah, so I just wrote into the hospital's department head. Yeah, so then
You should search on Google, is it?
yes, and then they were actually really kind enough to reply this student lah. Yeah. So I
But that
think,
must have, you need a lot of courage to write in actually.
So do you actually go for the attachment at diagnostic imaging?
Yeah, I went. It was at KKH, I think.
And what is it that made you choose RT in the end?
Well, actually, it's a very long process. So I think as a student, right, you don't really know what's the difference between being RT and being a diagnostic radiographer.
Yeah.
So then I went for the shadowing. I attended many healthcare professional fairs. Then I spoke to some of our already the pioneer batch of SIT students. So I got to know what they do, and then I watched a lot of videos, a lot of interviews with those professionals, and then I deduced that the main difference to me was the part where you get to build rapport with your patients as a radiation therapist compared to being a diagnostic radiographer, where you usually see your patients a one time off, and then personally just based on passion. I'm quite chatty, so I like to build rapport and I like to talk to my patients. So being a radiation therapist was the better option
better fit for
the
you.
better fit for me. Yeah, so I think through there it helped me to decide.
Wow, my experience is quite different. For you, you actually went to research the career
I
very
think quite
well.
extensive research, yeah, correct.
Coming in, right, I didn't even know what I was signing up for in the first place last time under Nanyang Poly. I just knew radiation therapy deals with cancer treatment. Full stop. And at that point of time, I was interested in the cancer aspect. So my first attachment as a student in a government hospital was what made me stay in the end, because I had a very good experience in my first attachment. And last time in Nanyang Poly also, you in your first year, you are already put into clinical attachment where you're just there to observe. You don't get to do hands-on yet, but it's just to familiarize yourself with the environment, and the main competency skills was more of
Patient interaction.
yes, patient care.
Patient care, yes.
Yeah. So
Infection control.
yeah, my first experience as a student was very memorable in a good way. So which is why I think coming back to this topic, the clinical educator is very important in building that impression on our students.
Very impactful.
Very, very impactful. And honestly, from then on, right, I knew this was what I wanted to do. Because initially, I really wasn't sure. And I had a classmate who actually, after first year, she changed her
Career.
course.
Her course.
Yeah.
I think
So,
you
yeah.
guys, the younger people, are really lucky already. So nowadays, in order to encourage more people, more students to sign up to being an AHP because of the growing population, then they host things like the Harder Plus programs. Then you guys, the older ones, they at least you can go to the YouTube to see what is RT about. So in my time, there's nothing.
How did you?
Internet just started. So I just
ask
based
you.
on the words on forms. Okay, this is description of radiotherapy. Do you like working with sophisticated equipment?
Yeah.
Do you like physics?
Technique.
So I
Do you
just
have
sign up based on
internet?
that. Yeah.
How did you find out in the first place?
Internet, but there's no YouTube videos. So I gotta imagine a bit. What am I doing? Machines, okay. Transformers, things like that, yeah.
Oh, yeah. You can see the generations.
Yeah.
How it has drastically improved. Nowadays, we are feed with a lot of information.
Yeah,
It's
on
very
TikTok,
easy.
Instagram, there's
Yeah.
Helping you to make your decision easier lah.
That's a podcast. Sharing
Oh, yes,
information
yes,
about
yes,
radiation
yes.
therapy.
That's why we have this podcast.
Yeah. Actually, Kevin, since you are the most senior and your last time when you were a student, how was your experience in undergoing clinical attachment? Do you think during that era, is it similar to how we would have experienced when Sarah and I were students in NYP? Because we were towards the last few batches already. Was the attachment expectation similar, or was it different?
different because things were maybe much simpler back then. We got one field treatment, two field treatment, we're using shooting blocks, and nowadays it's image guided. We got gating, all the use of fanciful machines and software. So things were much simpler. We were more maybe happy-go-lucky. So we just meeting our own expectations. I can clear this competency. There's no so much thought into mental well-being or how am I feeling. Nobody asks questions about that. Nobody questions the CE. So maybe more of respecting my CE so that he gives me a good report. My report gets marked off. So I just graduate. It's just 3 years. So I have to squeeze everything within 3 years. Now the degree program is 4 years. So and there's a thesis and honors.
Oh yes,
Yeah.
yes.
So
Yeah, we have
a
thesis.
diploma and a honors degree is different.
Yeah,
Same but
different,
different. Yeah.
Oh, actually, I've never seen a shielding block.
Shooting blog, really?
Yeah.
I've never seen a shielding block.
That's the generation gap
Not very
between
user friendly. Not very
Sarah.
good for your back.
So heavy.
So
Have you
things
used the
have changed so
wedge?
much. Yeah, over 20
my
years.
God.
Physical
Haven't
wedge.
put in before, I think. Or dynamic wedge lah.
Wow.
EDW guys. EDW.
Gosh.
And MLCs. Wow, but really
Kevin
very
is like,
different lah.
you have it good.
I have it good, I agree. I mean with the how to say like yes, maybe like the students now get more, opportunities to do their own research, they are like mental well-being is like is the talk of the town. I think it also comes with like their set of issues lah that can arise, makes everything a bit more complex and learning how to like teach this, like teach or like handle these students also takes a bit more skill.
Yeah. That's why I'm trying to find younger people to communicate with them more effectively
Sometimes
so
it's
that
also a vibe
we
thing.
can improve on their satisfaction scores. Yeah, so that makes them happy overall. The whole picture. It's not only coming here to learn practical skills or theory. So we want them to feel welcome and we want them to feel good and happy and looking forward to come for clinical placement and not just a chore or just to check things off their list. Yeah.
Very important.
Like, I mean, ultimately, they're going to be our colleagues. Some of them are going to be our
eventually.
colleagues in the future. So we have to start building
Start
that
when they're
rapport.
fresh.
Yeah.
Kevin, do you think you know like how many students are there in SIT right now that's applying for radiation therapy?
Or like the
You
new
won't
batch.
know. Like year 2,
The
year
intake
1, yeah.
is
Oh.
once in every 2 years, and what SIT has communicated with me is they only have space for 10 to 12 per intake, and I think it's quite competitive. They have to go through rounds of interview. Yeah, so it's quite competitive. Yeah.
I think the size now is even smaller because my batch was I think about 16. So there were like 16 of us.
Actually, I think your batch
No,
is quite
It's
big.
huge, right?
It's
Your
huge
batch is
already.
really
Yeah.
huge.
During I think Atika's time only 5 or
Actually, mine was 9. But we also have a batch where there's only 4 or 5
4 or
of
5
them.
of us.
Yeah.
That's
So
insane.
right from last time, the number
It
of
was
students
small.
is already small in the first place.
Yeah.
Also because like
There were only a few centers in the
Yeah.
past.
There's only
Yeah.
a few centers.
now there's a lot more
Private centers.
and our
Yeah.
capacity in NCC also has increased. Like we have more machines.
That's true.
Right. We also have a lot of bunkers here, which we will need it. We will buy more machines when we have the budget and if the cases pick up. Then we also will need the manpower to run it. So yeah, these students are our future.
Yeah. Wow. That's
Yeah.
profound. The
It
students
is.
are our future.
It's competitive lah, but if anyone is keen, please just try. If you're passionate about a job, apply for the degree. Come and join us eventually.
Kevin will take care of you while you're a
I hope,
student.
I'll
Yes,
still
you
be
will.
here.
Alright, it's been such an interesting episode.
Yeah.
Actually never heard those words from my CE, not my CE lah, but never knew about how deep the thought process behind being like a CEC or a C in general is, Really a lot of things to consider. And sometimes if you see like your CE, sometimes if they are so busy, they may not have time for you during the attachment, but I'm pretty sure that they are open to questions, they are open to helping you learn better. So always feel free to approach them. Don't be scared to do so lah.
Okay, thank you guys for having me.
Thank you, Kevin.
Thank you, Kevin.
Yeah, for sharing with us about your role, how you got into this role.
Thank you. It's my honor to be on this podcast.
Yeah.
Learn so much.
Yeah.
Hopefully you can come back again with us on the podcast.
Maybe we'll get future update.
We
Maybe like 3 years in.
3 years.
Any changes.
Maybe 3 years down the road he might have someone helping him also.
Oh,
Yeah.
that's true.
You never know.
Assistant already.
Yeah.
Assistant.
But
Yes.
I think for now we Actually, we're hoping to get Kevin's help to reach out to
Oh yes, that's
our
right.
SIT students who will be coming for attachment in the future to see what kind of questions they might have for us before coming in.
Yeah.
And hopefully that works out.
I think it will. I think it will. I think nowadays the generation, they are more vocal. Probably have quite a bit of things to ask lah.
Mm.
Right, and if any one of you guys are thinking of, doing a job shadowing, or maybe you are one of the students coming for attachment here, please feel free to drop us your questions, leave your comments, or you can drop us an email as well.
Mm-hmm.
Okay. Feel free to leave like feedbacks, more episode suggestions, or even encouragements for anyone, the speakers or the hosts. We would love to hear that from you.
Please rate, review, and subscribe. Follow our podcast on Spotify, YouTube, or wherever you get your podcast from.
Thank you for listening. This has been your dose of content for all things related to Integral to Radiation Therapy.
See you in the next episode.